Hey mamas, it's your Cajunstork here. Today I'm going to give you a midwifery tip on how to have an easier and better birth, especially if you're planning on having a natural birth, by something called the Sphincter Law. This is described by Ina May Gaskin in her book, Ina May's Guide to Childbirth, and I'm going to touch on it in today's video to give you a better idea of the Sphincter Law and how it can help you have an easier and better birth. Before I begin, my name is Midwife Kyra and I believe in truly natural birth because I know that it makes for better birth experiences. Consider subscribing to my channel and don't forget to join us every Midwife Monday for a new video. And if you want to look in the description below, I have a link to my pregnancy complaint kits, which provide herbs and supplements that'll help you have a better, more enjoyable pregnancy. So the Sphincter Law. What is a sphincter? Well, a sphincter is a part of our body, typically the vagina, the cervix, and the anus, that close and maintain closed until they're open, waiting for something to pass through. In this case, the thing that's passing through is your baby in preparation for their birth. Now, the best way to describe the Sphincter Law in a way that we can all understand is to consider having a bowel movement, because we all can kind of understand what something passing through feels like. What is the best way to have a bowel movement without having any problems such as pain, bleeding, hemorrhoids, things like that? Well, the first thing that you're going to need is privacy. You need a door, well, unless you're a mom, of course, and then it's possible privacy is completely out the window. But in general, in our society, we are trained to need privacy to be able to release and to let go. And so by having a closed door, a locked door, a toilet set aside where we can have some privacy and uninterrupted time, that is usually an easier way where we can let that sphincter go to let what we need pass through. When applying this to birth, having privacy in a birth is so important in allowing that cervical and vaginal sphincter to release and relax and let our babies out. Now, it's not just privacy that can help that sphincter open. Dim lights, a quiet space, protecting mom's space, not asking her too many questions, which I'll get to in just a second, just helping her stay focused on the task at hand in a safe, warm environment can help that sphincter to relax and let our babies out. So now let's touch on the not asking mom questions comment I just made. There are two parts of our brain that are used during birth. We have our primal brain, which is kind of the parts of our brain that we use when we're having really intimate sex, right guys? When we're connecting with our spouse, we are in a private space, we are not fearful of interruptions, and we are not asking questions and talking about laundry and chores and what's next on our to-do list. We're perfectly involved in that moment to have the most intimate connection. To give birth, we need the same environment that we set up when we're having really intimate sex with our spouses. And so typically dim lights, a quiet space, a secure space, some of us need a locked door, obviously no strangers, things like that can help us. When we're in our primal brain, it's easier to reach an orgasm, but in birth, it's easier to deliver our babies, which is why in our midwifery practice, we find it so important to know the healthcare provider who's attending your birth, because you're not having strangers come in at your birth. You know the midwife coming in and out your room. You don't have to learn their name or things about them or if they're going to apply interventions you don't want. And by being able to be in that safe space with someone you already know, it does help us to stay in our primal brain. However, in the instance that we engage our NeoCortex, this is a part of our brain that's engaged when we ask questions or are asked questions, or when we're instructed to do something. It could be as simple as, do you want to switch positions? Which is a very mindful, kind question to women in labor. But when we're being asked questions, we're pulling out of our hormonal brain and into our neocortex, which requires us to be present and answer questions and think things through, which actually makes our sphincters tighten. Other things that I have actually personally experienced watching birth in a hospital setting. One time a mom was trying to give birth. While she was pushing, they were asking her about her insurance information. That is completely pulling a natural birther out of her hormonal brain and into her neocortex, which not only tightens those sphincters, but makes birth more painful and more intense and typically lasts longer as well, because obviously it's easier to birth a baby or have a bowel movement or have an orgasm when we're relaxed and in our hormonal brain rather than tight and rigid and in our neocortex. Now, one of the things you really should know about the Sphincter Law is that sphincters do not obey commands. You can't fuss at a cervix and make it open. And in fact, you're gonna get the opposite effect if you fuss at a woman in labor. The same can be said again for bowel movements or having orgasms. You can't tell someone to have an orgasm. You can't tell someone to have a bowel movement. Sphincters do not obey commands. So again, by allowing mom to be in a private, safe space that she feels comfortable in and allowing her to relax, that sphincter relaxes and lets our baby come through. So telling moms to push in labor is actually opposite of what we need to be doing, because the more we say push, push, the more we're actually closing down that sphincter and making it harder for her to push. In addition to that, telling her to not push. Maybe the doctor's on the way and they haven't made it yet. Telling a mom to not push actually closes down that sphincter and does actually prevent her from having her baby comfortably and easily. So it is a tool that we can use, especially if we're waiting on a healthcare provider to arrive for a safer birth experience. But is it a tool that we should be using in labor? I'll touch on that in another video. Not only do sphincters not obey commands, but they can also shut down when you're startled or frightened. So again, it's really important that we maintain birth etiquette in a birth space so that we can do our best to encourage moms to relax and release and let our babies out. So we talked about things that close sphincters during the sphincter law. Let's talk about things that open our sphincters. One thing that most people don't know is laughter actually can help get us to have a faster and easier birth. That open glottis, open throat, belly laugh that some women have in labor, especially if you're watching YouTube videos where women are birthing naturally. If we're open here, we're actually open down in our pelvic floor as well, which is really beautiful. If you've ever seen a woman laugh her baby out, there is nothing like it. It is so incredible to watch. And so deep belly laughs in labor help us with the sphincter law. In addition, and let's be honest, you guys, how many of us are really gonna laugh our babies out? This is this really beautiful idea, but it's not realistic for most of us who are working really hard in our labor. So one of the things that we can do for those of us who may not laugh in our labor is deep guttural noises. So it's really, really important if you are attending or assisting someone in natural birth, if they start to make high-pitched noises, that we do our best to bring them down to low-pitched noises. Oh. Did you guys see the difference in my body when I made those two noises? I want you to watch again. Watch my face. Ah! You see my face is tight, my lips are tight, my hands are tight. We have to tighten our body to make high-pitched noises, and in turn that tightens our sphincters. But when we're making deep, low noises, you can see my throat is relaxed, my shoulders come down, and because of that, our sphincters open and release the way that they're designed for birth. So one of the things we can do, again, is to encourage mamas who are making a lot of noise in labor to bring that high-pitched noise down to a deep, low-pitched noise. And a midwife tip on how to do that is just to make the noises with her. Sometimes in labor we get a little bit embarrassed about the noise that we're making. I've heard mamas describe their labor sounds as like gorilla noises. Mamas, that means you're doing it right. Those deep, deep noises where we sound like we're mooing like a cow, or those deep, deep noises, those gorilla noises, that is what helps our sphincters to open. And at the end of the day, you want a faster, easier birth. So don't be embarrassed. And if you are embarrassed, make sure you tell your birth partner in advance that you want them to make those deep noises with you if you're feeling embarrassed. Because again, embarrassment is going to tighten that sphincter. We want to do everything we can to loosen that sphincter and have an easier birth. Another tip that I can give you guys that you need to add to your birth plan is ensuring that permission is given to anyone offering a vaginal exam. When we are asked permission to have our sphincters entered into a vaginal exam, anything like that, by offering permission, we are more able to relax our sphincters and allow whatever is occurring. Again, we talked earlier about a sphincter is that allows something out, but in the case of birth, it might be allowing something in, such as fingers for a vaginal or cervical exam. And so be sure to write on your birth plan that mom must give permission to have vaginal exams. Now, we shouldn't have to write this on our birth plan. This is just common decency and dignity, but sadly, with the way that our society is going, this is definitely something that should be added to your birth plan if you're not planning a midwifery-led delivery. Another recommendation I always give too to my mamas planning hospital births is I would prefer that you guys only allow vaginal exams from your healthcare provider directly. It's not uncommon to have a nurse and then her backup nurse and then the nurses switching shifts and then the backup doctor all perform vaginal exams on you when you're admitted to the hospital. I highly recommend that, again, privacy and an environment of familiarity, that we know the person who's providing our vaginal exam, and by doing that we can relax that sphincter and allow the vaginal exam more easily and more comfortably, which in turn again helps with a faster and easier birth. So that is my information on the Sphincter Law. I hope that you're able to apply it to your upcoming birth. If you guys have any questions or any additional tips, you want to add it in the comments below. I would love to hear your advice on the Sphincter Law and how we can apply it to our upcoming birth experiences. Thanks for watching. Bye-bye.